Welcome to the Love Letters to Our Bodies podcast. I'm your host, Gwendolyn Mitchell, founder and CEO of Moyo Institute and lifelong spiritual seeker and energy worker. Here for thoughtful conversations about health, healing, and happiness by, for, and about Black and African American women. Disclaimer, the Love Letters to Our Bodies podcast does not provide medical advice. The opinions, experiences, and insights shared are for informational purposes only. Nothing shared in this podcast is intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other healthcare provider. Don't disregard or delay seeking it because of what you've heard on this podcast. Thank you. Are you ready? Let's dive in. My guest today is Melbra Watts. She is the executive director of the Charlotte Maxwell Clinic for Integrative Cancer Care here in Oakland, California. Welcome, Melbra. Welcome.
Oh, thank you, Gwen. My pleasure.
It's such a pleasure to have you with us today. I feel like I gained a friend and a fellow spirit being on the path. And it's been such a joy to work with you over the past couple of years on the Love Letters to Our Bodies workshops. So welcome, Melbra.
Oh, thank you, Gwen. I felt the same way from the time you called me and we met and just started putting the whole thing together, sharing ideas, and it's just a real special connection. So thank you. Thank you.
Beautiful, beautiful. For the benefit of our listeners, I'd like to let you know that Melbra Watts is the executive director of the Charlotte Maxwell Clinic in Oakland. It's an integrative cancer care clinic. She's a visionary leader and a seasoned professional with extensive nonprofit management experience in economic, career, and workforce development. Always health conscious, Melbra shifted her focus to wellness and holistic development and managed a private practice as an energy healing practitioner while facilitating kitchen table talks for goals for women. That's interesting. And mindful tapping meditations for the Women's Cancer Resource Center. And Healing Our Wombs ceremonies for 2 California Women of Color Symposiums, a UC Berkeley annual Empowering Women of Color conference, and an Association of Black Psychologists annual conference. Melbra is also the board president of the Way of the Earth Keeper, a nonprofit organization committed to preserving Indigenous practices and wisdom. We'll have to get into that a bit too. Melbra has earned a BA in social welfare from UC Berkeley, an MBA in management from the Golden Gate University, African ritual healing initiation from Ancestors Wisdom Spring, and certifications in shamanic energy medicine from the Four Winds Society, and community-based models for Black mental health from the California Institute of Integral Studies. What I can say, Melbra, reviewing your bio, is that you sound like a woman after my own heart, always open to learning new things and taking that knowledge and putting it to use for the community.
Absolutely. Absolutely. I think it started off with just me trying to find my own healing, finding a place where I felt I could take care of my mind, not only my physical body. You know, we go to work every day and do all the things we need to do, but it was like mentally and spiritually, I felt that there was no support for that in the workplace. And as I worked with individuals who were going through different changes, whether it was being laid off from their job or just through other kinds of changes, life changes. And then I felt like I was going through my own life change where I was just questioning everything and needing to find that place of center and healing for myself. Just that's kind of how I started on that path.
Yeah, it sounds like an existential crisis, which is
Yeah.
one of those major life transitions that we all eventually have to go through in order to be
Mm-hmm.
able to move into a life of purpose,
Mm-hmm.
a life with meaning. So much of our early time is spent in developing skills and climbing the career ladder,
Mm-hmm. Mm-hmm.
and the part that's missing is the part that speaks to our heart, our spirit, our soul. So I'm really happy that you chose to do that work, and that has, I'm sure, made a tremendous difference in your life overall.
Yes, it has. Absolutely.
So, Melbra, one of the things we want to talk about today is the Charlotte Maxwell Clinic, where you serve as executive director. The clinic is an integrative cancer care clinic, and I understand that it is targeted to low income women. And can you talk a little bit about that? What is the mission of the clinic, and who are you primarily serving?
Yes. So, yes, Charlotte Maxwell Clinic is a 32-year-old nonprofit women's clinic based in Oakland, California. And its mission is providing free access to complementary therapies for low income women with cancer. And I think the key thing that distinguishes what we do is that we provide complementary integrative care at no charge. When we think of cancer treatment, and everything needs to be covered by insurance, and when you're thinking about, well, we just know that there are a lot of side effects from the cancer and the conventional cancer treatment. Everything from anxiety and depression to nausea and fatigue and all of those kinds of things. And we know that a lot of times a person's quality of life really suffers during that time and after. And so Charlotte Maxwell herself, a pretty progressive women's advocate back in the 70s and 80s, she actually ended up having ovarian cancer and, of course, went through the conventional route, but also assembled a group of women who were versed in Chinese medicine, traditional Chinese medicine and massage and homeopathy. And it did so much to relieve just that suffering that she was experiencing from her regular treatments. And being a social worker and public health advocate, she says everybody should have access to compassionate care that not only deals with you physically, but also helps you to feel better, helps you to find a little bit of meaning in what you're going through, that help you to kind of re-nourish your spirit. And years later, so this was back when complementary therapies, having that was a radical idea. And years later, studies have shown that complementary therapies actually do improve the quality of life. They actually do boost the immune system so that the women can recover from the radiation and the chemotherapy and surgeries and different kind of things that they go through. And it just helps to, just rebuild their mind, body, and spirit. It helps them to actually heal their spirit.
Mhm.
So that's what Charlotte Maxwell does. And I would say the thing that really distinguishes us is that we provide one-on-one complementary therapies, so that whether it's acupuncture or massage or Reiki, nutritional consultations and exercise therapy, that it's one-on-one. Yes, we do also provide workshops, but the thing that distinguishes us is providing this diverse range of complementary therapies all in one place, so it's convenient for our clients to come. And also, they're provided the way we're able to provide it at no charge is because we have volunteer practitioners as well as program support, but it's the practitioners who step up and have always been really dedicated to providing these services for the community.
That's wonderful. And I understand that's how you became introduced to the clinic. You started off as a volunteer healing practitioner there.
Yes, yes. So after I kind of thought I left my nonprofit management experience, I'd already been taking some courses in energy medicine and decided, a friend actually recommended Charlotte Maxwell Clinic for me to volunteer at. And I said, oh, sure, that'd be great. And I started doing my energy healing with the women and got such positive feedback from them that, where they came in and they had pain, by the time they were finished with a session with me, the pain was gone. They would say, oh my goodness, I feel so much better. Or I feel so rested. For many, they can't sleep and that kind of thing. And just to be able to have that time where they're able to go into a nice, deep relaxation and to get the feedback is, I have not rested like this in such a long time. And other kinds of things, just insights that gave them that energy, that sense that, oh gosh, okay, I can keep going through my rounds of treatment. I can keep going through this journey, which is very arduous at times for some people. And so that was very, very rewarding too.
Beautiful, beautiful.
Mm-hmm. Work with them in that way.
Yes, and you mentioned healing. And one of the things we talk about in the Love Letters workshop is the difference between healing and curing. Mm-hmm. And what I love about Charlotte Maxwell is that it acknowledges the role for traditional complementary therapies as well as the primary way that people are being treated in the Western medical model. Yes. We talk about curing as the removal of symptoms, mm-hmm. and healing as actually going to the core of the problem and addressing it at that level. One of the things that I know from my own background as a healing practitioner is that sometimes people can be cured but not healed, and they'll experience a recurrence of the disease. Mm-hmm. Or they can be healed and they might still have the disease, but their relationship to what is happening within them and in their lives and in their bodies changes significantly.
Yes, absolutely. You're absolutely right. That is the case. And we've heard from several women who have gone through the process that it helps them to, having these complementary therapies helps them to get into a deeper connection with their own spirit, their own selves that maybe they had lost prior to and up through their cancer diagnosis, that they didn't really think much about their bodies. They didn't really honor their bodies. And of course, there's just everyday life, working day in and day out, or running your business day in and day out, on the go all the time, not eating well, or perhaps even having had some traumatic experiences early on in their lives that have left kind of psychological scars, if you will, mm-hmm. where they're kind of putting themselves down or mm-hmm. not somehow really giving themselves the benefit of the doubt. And so these kinds of things can turn into
illness
and disease. That's true.
The Love Letters to Our Bodies podcast is sponsored by Moyo Institute Incorporated, a nonprofit organization offering heart-centered educational experiences, and the Lloyd Symington Foundation, which supports visionary grassroots cancer programs. Yeah, I think of it as an energetic imprint in the field of the
Mm-hmm.
person when there are those unresolved traumas. And also you mentioned a lot of the things that we're involved with on a day-to-day basis. And also women have taught to be caregivers of others. And so what I found in the workshops is that some of the women say that they were really accustomed to serving other people and taking care of other people and always putting themselves last.
Right.
And part of the thing that's shifted with their experience of the disease is learning to have to put themselves first.
Mm-hmm.
The
Mm-hmm.
other thing is that the traumas, one, we do look in the Love Letters to Our Bodies workshops at whether or not there have been early traumas, because we want to call that to the attention of women who have buried those into their subconscious. And we actually ask whether or not they happened at an early age, whether or not it's happened in their young adult life, and whether or not they got support when they asked for it, if they asked for it, or did they internalize it as a form of shame. So it's been really insightful to hear what the women have shared about those experiences as well.
Mm-hmm. Mm-hmm. Absolutely. And how we're really challenged to change. It's interesting. When I started my position with Charlotte Maxwell Clinic, it was in January of 2020, and it was 2 months before the pandemic. And I have to say, the pandemic, in a way, was a gift for us because it really helped us to shift what we were doing. And we were able to take advantage of some resources that became available during that time. And sometimes what seems like the worst thing that's going on can be a gift. It can be something that can help us to really recognize life and see life in a different way and appreciate all of the little miracles and angels and different kinds of things just in a whole different way. We just have a different view of life when we realize, oh my God, this could be all taken away. I could lose my life. And so that's one of the things that I've heard from people, is that it was a gift for them to make a change, to change their view, to possibly change their behavior and their habits and see things differently.
Absolutely. A lot of the women report that it has been a gift because they didn't even realize, how much they were stuffing down,
Mm-hmm.
how much they were disconnected
Mm-hmm.
from their own being,
Yes.
and how much they had put themselves to the side. So this process, this journey with cancer has been a healing experience for many women as
Yes,
well. Yeah.
absolutely. And I think part of the thing that I love about Charlotte Maxwell Clinic is that one of our principles is making sure that we don't, but also encouraging women not to, our clients, not to blame themselves for having contracted the illness or the disease. And so this is really something I think as part of the healing process. It's opening your eyes to see what you didn't see before, but not blaming yourself because you didn't know. And so now you know. And so the more you know, the better you can do better.
Actually, yes, as Maya Angelou famously said, when we know better, we do better.
Yes.
Yeah. I think that is so, so important because many people do feel some shame about having contracted the disease because of the kind of messaging that they've heard out in the wider society.
Mm-hmm.
Some people want to keep it a secret. They don't want people to know that they have the disease. But you're right, there is no blame. And there are so many factors relating to when a person or why a person has a disease that none of us are able to really truly say.
That's true.
Sometimes it could be karmic. And I always like to say in the healing circles that I do that that person may be carrying this burden for society, that that person may be holding this disease in their body so 20 other people don't have to hold that disease. And it's such a beautiful way to think about it. And it really frees up the mental space and allows us to see also people who are going through the journey from a different perspective as well.
Yes, absolutely. Absolutely.
So tell me about how Charlotte Maxwell gets its support. I mean, is it from individual donors? I love that you have all these volunteer practitioners coming in, and it's a way for people to be of service and find purpose and meaning as well.
Yes, thank you. Yes, we really appreciate all of the volunteers and the fact that that model has been able to exist throughout 32 years of Charlotte Maxwell being around. We do rely on individual donations. We don't qualify at this time for government funding or insurance reimbursements. That's one of the issues I think that contributes to a little bit of the disparities in terms of healthcare access. Complementary therapy, having access to complementary integrative care really completes the care for a person who's been diagnosed with cancer. It's one thing to have the radiation, chemotherapy, surgery, medications, and all that kind of stuff. But as you said earlier, if we don't get to some of the core causes and factors and address those as to why one becomes diagnosed in the first place, there can be a reoccurrence. And at this time, there are a number of medical centers that are offering what they call comprehensive cancer care that includes integrative care. Oftentimes, it's group support groups and different kinds of things like that. There can also be individual acupuncture or massage therapy and everything. We have heard from our clients that oftentimes going back to that hospital is traumatic for them. They get a little bit lost. And we offer a safe space, a nurturing space where it's a little home-like atmosphere. And we're able to just kind of offer a little more, a less sterile kind of environment for them, so that we have a food pantry where they can get organic, fresh fruits and vegetables and prepared soups and meals so they don't have to go home worrying about what they're going to eat, as well as just practitioners who really, I think there's something about them volunteering their services, and there's just such a connection that takes place. We hear from our volunteers that, oh my goodness, they get so much out of doing what they do, providing these services for women. And so it's a very special place. Yet we are renting space in a building in a high rent area. And we do have to keep the lights on. We have technology that we have to take care of and all those kinds of things. And so certainly the donations that we receive from individuals and from foundations that really understand what we do and the importance of what we do for women in our communities, as well as some corporate partners who appreciate what we do. We really appreciate it. And it's a constant asking for support.
Striving to receive. Yes.
Yes.
Yeah.
Being grateful and keeping the hand open.
Absolutely. Absolutely. Well, this has been like very, very informative. I'm sure our listeners know someone who could benefit from the service. I'm sure they know people, including themselves, who are able to make donations to help support the work. And I want to thank you again for all that you're doing in leading the mission of Charlotte Maxwell Clinic, and also and your open-hearted support for the Love Letters to Our Bodies workshops, and the insights and the beauty that you bring to that process as well.
Oh, blessings to you. Thank you so much, Gwen. It truly is a privilege, I feel, to be able to be in this position with Charlotte Maxwell Clinic. The whole sense of being able to provide complementary therapies, the validation of those techniques and therapies that really help us to rebuild, reconnect to our mind, body, and spirit, to me is just so valuable today. And I feel that it's just really, really important for people to do that. And sometimes a cancer diagnosis is the thing that gets us there. So I want to thank you for allowing this and recognizing me as well as the clinic. And I want to thank you for all that you do in raising awareness of this issue. And yeah, and in this very special way that you do it, so that we can, again, reconnect and develop that new bond with ourselves to love our bodies as they give us the information.
Yes, yes, yes. Thank you so much. It's a labor of love and a joy. And as you said, it's so fulfilling to hear from the women who attend the workshops how much they learn, how much they feel transformed by the practices that are very simple that can help them as they journey with cancer.
Yes.
Both the patients and the survivors and the thrivers. So
Yes.
Thank you for being our partner on this beautiful, beautiful healing journey.
Thank you. My pleasure. Blessings.
Blessings to you. That's a wrap. Thank you so much for listening to Love Letters to Our Bodies, conversations on health, healing, and happiness. To find out more about the Love Letters to Our Bodies project, visit our website at moyoinstitute.org. That's MOYO Institute.org. Follow us on social media and subscribe to the podcast so you don't miss an episode. If there are topics you'd like for us to discuss, let us know. Remember, your body is beautiful, girlfriend. Love it.